In this morning's Woman's Doctor, if you've had a hysterectomy, you may assume you can't be diagnosed with ovarian cancer, but that is not necessarily true. While having your uterus removed does decrease your risk of developing ovarian cancer, it is still possible to get. And joining us live this morning with Mercy Medical Center is Dr. Kolpatia. Thank you for joining us this morning.
Oh, thank you for having me, Jen. Appreciate it.
You're welcome. So the reason for developing ovarian cancer is because not everyone gets their ovaries removed with that hysterectomy.
Right. Especially in younger women in the 30s and 40s, we keep those ovaries in because they play an important function in protecting cardiac health, protecting bone health. But as women age, they still remain at risk for having ovarian cancer in the future.
And so is it a conversation that they should have with their doctor at the time of a hysterectomy, sort of the benefits of keeping your ovaries?
Absolutely. Both the benefits and risks need to be explained at the time of the hysterectomy. And with the doctor, the patient will make that important decision as to whether to keep those organs in place. And similarly, some women in surgeries have make the decision to keep their cervix in place, and they'll need to have that conversation about keeping an eye on the risk of cervical cancer going forward.
So what are some of the symptoms of ovarian cancer?
So some of the symptoms, they're pretty, they sound innocuous, but people who have like persistent reflux, abdominal distension or bloating, so sometimes they feel full after eating quickly, eating small amounts, urinary complaints. So when these sort of small symptoms, when there's multiple of these symptoms and they're persistent or new, that's when it kind of should raise our alert a little bit to bring that attention of your doctor and maybe look for any symptoms of ovarian cancer.
Right, and what are some of the testing tools that you use for that?
So usually we would start with a pelvic sonogram, which is a really good way to visualize the ovaries and the pelvic symptoms.
Okay, and so you talked about age playing a role in deciding whether or not to keep the ovaries when you do a hysterectomy. So is there sort of an age cutoff? Are we talking maybe after menopause?
Yeah, exactly. I think after menopause, that's really where it kind of becomes very much of a judgment call. I mean, the ovaries don't make as many of their hormones after menopause, but there are studies that show that both quality and length of life can even be retained by keeping their ovaries in, even after menopause to some degree.
Okay, all right. Well, Dr. Kolpatia, thanks so much for joining us. Really appreciate it.
No problem. Thanks for having me.
You are welcome. And if you have any other questions or you'd like a referral, just call 1-800-MD-MERCY.